In our last video, we had discussed about breast shaping and breast reshaping. So one of our followers has asked a question about breast enlargement with the help of fat grafting. So I'll be talking in detail about that particular procedure. Now, fat grafting for breast is a wonderful procedure. It has a lot of advantages, that it is something which is natural. We take your own body fat and we put it where it is required, where it is deficient, where you feel like we want an enhancement. So breast augmentation with the help of autologous fat grafting, this is the term. Now we have to understand about it. How do we go about it? Now there is a breast shape, a breast size, and if anybody wants a change in their cup size, a change or enlargement of their breast, so there are various options. The one is silicone gel implant, we have talked about it. Now we'll talk about fat grafting. So what we do is we assess the body from where we can take the fat from the patient's own body. It can be a tummy area, it can be a blank back or a flank area or a thigh area where there is slightly unwanted excess fat. We remove that fat, it is collected in again a sterile jar, and then it is processed. It is processed and filled into syringe, and then we get back into the area where we want to do it. Now fat processing is technically a total separate thing that is done on table. We can show you how we do it, we'll show you in a short video. And after that we put in the fat. Now this fat is put in layers in all over the breast and any place where we want more enhancement or more of a lift, that is put. On an average, in a single breast, in a single session, we can go like 250 cc's to even 400 cc's of fat. But it is better to be on a lower side in a single session, because whatever fat we are giving in the breast, all these fat cells, they are live cells, they need a good amount of nutrition and supply. So they need a new blood supply into that breast. We cannot overdo it. And there is a part of fat that is absorbed by the body. So whatever we put, there is around a 40 to 50% of absorption of fat as well. So final result is almost around an increase of 1 cup size. So if we are desiring a very large change, then I won't say it is a very good method for doing it, or we have to do it multiple times. Means in a single session, we can enhance up to around a 1 cup, like from C to D or double D, or even 2 cup size increase. Then the results come in around say 4 months time, because in 4 months time it is almost settled. Whatever fat has to be absorbed by the body, it is absorbed. After 4 months time, we reassess and see the shape, how it has come. And now if the patient wants, yes, we want some more or some changes, we can again do the procedure, repeat the procedure second time to add on more, to increase the cup size more. So this is how we do fat grafting. For a smaller increase, one-time procedure is good enough. If you want a larger increase, then it has to be multiple sessions, 2 or 3 at an interval of around 4 to 6 months. Once done, the results are permanent. Now, this is a wonderful method because this is your own fat. It is autologous. So no foreign body is there. The negative sides are like this particular procedure cannot give you a lot of lift. So if we are looking forward for a lift in the breast also, then this is not the procedure of first choice. Then there are something else add on to the fat grafting that we have to do. So the procedure has to be modified according to the patient. But yes, this is a wonderful procedure and we recommend this procedure for fat grafting. And if you want to know more about detail about the fat grafting or any other queries you have, any other questions you have, you can just call us or DM us at our contact and we'll be ready to help you.